Discharge education after neck surgery. St. Mary's Hospital is the right place to be when you have spine surgery. Since you won't be in the hospital for very long, we want to take every opportunity to be sure you have tools and information you need to continue your progress after you leave the hospital. After you review the basic information in this video, your nurse will provide specific instructions from your surgeon. So write down any questions that come to mind in order to be confident that you are equipped to leave the hospital safely. After you get settled in at home, you will need to call your surgeon's office to make your follow-up appointment. Your nurse will tell you what the time frame for you is to schedule that visit. Your surgeon will be prescribing pain medication for you to continue to take at home. It is very important to keep track of when you are taking all prescription medication. Start a log of your medications, including the time you take them, to ensure that you are taking them at the correct time intervals. Your nurse will review side effects of any new medications. Remember to contact your surgeon if you experience these side effects. If you would like to have your prescriptions filled before leaving the hospital, you may use our outpatient pharmacy, which is available Monday through Friday. For your convenience, your nurse can send the prescriptions to the pharmacy to be filled, and when the order is ready for pickup, your coach can take the paper prescriptions to the pharmacy and pay any co-payment at that time. You may opt to pick up your prescriptions at your own pharmacy on the day you're discharged. Remember that if you run low on narcotic pain medications at home, you will need to contact your surgeon's office. The pharmacy cannot refill them by phone. You will need a paper prescription from your surgeon's office. Discomfort is a normal part of recovery. Multimodal pain management allows for more effective pain control with fewer side effects by combining opioid pain medication and Tylenol along with ice and activity. Take pain medication as prescribed with meals or a snack and at least 8 ounces of water. Take pain medication before activity and at bedtime as needed. It can take up to 30 to 45 minutes for medications to decrease your pain. As you recover, decrease the amount or the frequency of your pain medications. Notify your surgeon if the pain medication is causing side effects such as drowsiness, dizziness, upset stomach, or unrelieved constipation. Avoid alcohol during your recovery as it increases your risk of falling and it interacts with other medications you may be taking. Tylenol taken regularly is also effective in managing your pain and minimizing the need for opioid pain medicine. Sometimes positioning during surgery can cause sore shoulders, and ice packs can be helpful. Do not apply the ice directly on your skin. If the cold is uncomfortable, use an additional layer of cloth under the ice pack as needed. Throughout this presentation, we will refer to red, yellow, green zones to assist you during your recovery at home. In each zone, we will discuss common symptoms and issues you may see at home and what to do about them. We will teach you about issues that are a normal part of your recovery, the green zone, symptoms that need to be discussed with your surgeon or primary care provider, the yellow zone, and symptoms that require immediate medical attention, the red zone. After surgery, it is common to experience some degree of constipation. That is why we start right away to give you stool softeners in the hospital. When you go home, you need to continue to take something to manage constipation every day as long as you are taking narcotic pain medicine. It is important to increase your water intake, add more fiber to your diet, stay as active as possible. For some people, warm prune juice or hot coffee may be all that they need. But if you don't have a bowel movement by the 3rd or 4th day after surgery, you can't ignore the problem. You need to add an over-the-counter medication, for example, a fiber product like Miralax or even a Dulcolax suppository. Medications are not usually intended to be a long-term solution. As you become more active and are able to move away from the pain medicine, which causes constipation, you need to focus on a healthy diet to maintain a good routine. Pay attention to high-fiber foods such as whole wheat bread, bran, and oatmeal. And don't forget the fresh fruit and vegetables with at least 8 cups of water every day. Management of constipation is a normal part of the green zone after surgery. If you have a gauze dressing on your incision, it will need to be changed every day until the drainage stops. You may begin showering once the drainage slows down, usually 2 to 4 days after surgery. Get into the shower with your dressing in place. After showering, remove the wet dressing and apply a new dressing and tape. Your nurse will show you how to change the dressing and provide you with the supplies for home. It is very important for you and your coach to wash your hands before changing your dressing. Yellow zone is the caution zone. Call your surgeon if the incision continues to drain, the drainage has a foul odor, the area around your incision is red, swollen, or painful, or if you have a fever of 101 or above that continues. Follow your surgeon's specific instructions about when you can shower and whether you can remove your collar. Always take a shower when someone is at home who is able to help you. Generally, most patients can shower 2 days after surgery. If you are cleared to remove your collar, be especially careful to keep your neck from turning while you shower. You can leave the dressing in place while you shower, then remove it immediately afterwards. Let the area dry completely and apply a new dressing. Tub baths, pools, or hot tubs are restricted until you are cleared by your surgeon. Neck collars are used after surgery to protect the surgery and help you to heal. The collars should be snug. You need to follow your surgeon's instructions about when to wear it and when you can remove it. When the collar is off, be careful not to bend or twist your neck. If you are told to keep your collar on in the shower, be sure to remove the wet pads immediately after that shower and apply dry pads. Neck precautions are intended to protect you and to allow you to heal. Sitting for prolonged periods of time will be uncomfortable for you after surgery. Changing position frequently is important. Sitting in a supportive chair with armrests will help you to get up and down more easily. Definitely limit anything that you lift to under 5 pounds and be careful not to strain, twist, or bend your neck. Compression stockings can improve circulation in your legs and are intended to prevent the development of blood clots. You will be asked to wear them for a week after surgery, removing them at night and putting them back on first thing in the morning. It is important to smooth out all the wrinkles and pull them up over your thighs. During your recovery, it is important to manage your overall health and prevent complications. Smoking can affect health and increases your risk of lung issues after surgery. If you have diabetes, make sure you are following your diet and taking medication if prescribed. If your blood sugar is higher than 180, contact your primary care provider, as elevated blood sugars increase your risk of infection. A healthy diet, including lean protein, whole grains, fresh fruits, vegetables, will help your body to heal after surgery. To prevent pneumonia, continue to use your incentive spirometer at home 4 or 5 times a day, 10 repetitions each time you use it. Walking is very important as you recover. Balance rest and activity. Plan for short rest periods during the day. Start with short, frequent walks and increase the distance each day as you gain more strength. If you feel dizzy when you first get up, sit a few minutes before walking. Limit stairs at first, but you may increase the amount of stair climbing as you feel stronger. When sitting, use chairs that have arms, backs, and firm seats. Be cautious of low toilets and low chairs. Limit the amount of time you sit to 20 or 30-minute intervals. Sitting for prolonged periods of time will be uncomfortable for you following surgery. To prepare for the ride home, you or your coach should make sure the passenger front seat is moved back as far as possible. A plastic bag on the seat can make it easier to get into the car. If you have a long drive home, you need to stop after 45 minutes or an hour and get out and move around to decrease stiffness. Your surgeon will instruct you about when you are cleared to drive yourself after surgery. When you get home, you may experience a period of time when your pain seems to be worse than it was in the hospital. That can be a normal phase after surgery. Try to write down when you take pain medicine so that you are sure you are following the guidelines. Remember that short walks every hour or so can actually help you to feel better. Limit your sitting to 20 to 30 minutes at a time. These are all normal issues that you may experience and are part of the green zone. There are times when you may need to call your surgeon and report symptoms that are not normal. This is part of the yellow or caution zone. Nausea or vomiting, severe headache, severe pain not relieved by pain medication, or any of these other issues should be reported to your surgeon. We want to do everything we can to keep you from having to make a trip to the emergency room. Symptoms of infection should be reported right away. Fever above 101 degrees, increasing redness around an incision, foul-smelling drainage. Those are symptoms that should be evaluated. If you have concerns about a blood clot, such as calf pain or redness and swelling in the legs, call your surgeon so that they can determine if you need to be scheduled for an ultrasound test that is used to identify blood clots. Sometimes when you have surgery, other medical conditions may need to be addressed. This is part of the yellow caution zone. Please call your primary care doctor if you have concerns about conditions such as diabetes, high blood pressure, asthma or breathing issues, congestive heart failure, or atrial fibrillation. It is a general recommendation to check in with your primary care physician after you have had surgery. There are rare occasions when you need to get medical attention right away. This is the red zone and requires you to stop and get immediate care. If you experience sudden shortness of breath, chest pain, localized chest pain with coughing or deep breathing, it is time to call 911 and get the medical attention that you need. This concludes the information in our video. After you complete your therapy and the doctor gives you the green light to go home, your nurse will review specific discharge instructions from your surgeon. When you get home, refer to these discharge instructions for guidance throughout your recovery. Be sure to ask us any questions that you may have before you leave the hospital. Thank you for choosing to have your surgery at St. Mary's Hospital. It was a pleasure to care for you. We hope that you have received compassionate care and that your experience was positive. Best wishes to you for a speedy recovery.